A common question that every patient has is, what is the timeline to go through breast reconstruction and complete the whole process? When can I be done? That's a very difficult question to answer because every patient's situation is very unique. And it really depends on many factors that are guided by your oncologist, both your surgeon and your radiation oncologist and medical oncologist, because a patient may simply need surgery and that's it to cure her breast cancer. Another patient may need chemotherapy first and then surgery and then possibly radiation after that, depending on her response to chemotherapy. And so there are a lot of steps along the way where there are questions that remain unanswered for a period of time. And as we get more information to be able to answer those questions for each patient, then we get more information to be able to determine how long their cancer treatment is, when the finish dates are for their cancer treatments, and that also guides when I can complete the reconstruction. But let me try to distill it down into a general timeline of reconstruction from beginning to end based on the type of reconstruction that a patient selects. So let's take, for example, implant reconstruction. So if a patient is appropriate to have an implant to rebuild her breast, then over 90% of patients will follow a two-surgery treatment process. The first surgery is the mastectomy, or double mastectomy, at which time I place a tissue expander as a temporary spacer implant. Please see my segment on the tissue expanders to learn all the details about tissue expanders, but that is the first surgery. It typically takes for a one-side reconstruction on the order of about 3 hours from start to finish, including the mastectomy, to the time I complete the placement of the tissue expander. The patient stays in the hospital overnight to make sure she's nice and comfortable without pain, and she's able to go home the next day. Over the ensuing week, while she's recovering from the mastectomy, the pathologist looks at the tissue to make sure that A, there's a negative margin. In other words, all the breast cancer has been removed successfully from the breast, and there's no possibility that any cancer cells were left behind in the breast. If there's concern that there's a positive margin, in other words, there were some cancer cells left in the breast, then the breast surgeon and the plastic surgeon and myself, we would have to go back to surgery in order to make sure that we're getting all that breast cancer tissue out and that we're 100% sure that there's been no breast cancer left in the breast, so that we can be sure that we're finished with phase 1 of surgery. The other thing that the pathologist checks is if a sentinel lymph node was removed, then the pathologist is going to look very carefully at the lymph node under the microscope to make sure that there's been no cancer cells that have migrated to the lymph node. That's called metastases, it's called metastatic spread. If there's evidence that there are cancer cells in the lymph node, then that could mean that the patient needs chemotherapy, could mean that she needs radiation treatment. It also is a function of how many lymph nodes are removed, and that determines if more cancer treatment is required. Oftentimes we can make that initial decision in the operating room through what's called a frozen section. A frozen section just refers to the microscopic examination. A pathologist looks down the microscope of a freshly prepared sentinel lymph node that has been taken immediately from the operating room, immediately from the surgery, and the pathologist looks at that tissue to see if there's any evidence of cancer spread to the lymph node. So we can get an intraoperative assessment. We can get a decision in the operating room of, yes, there has been cancer spread to the lymph node, or no, there seems not to be any cancer spread in that sentinel lymph node at the time of the surgery. So the long and short of it is that you're getting the sense probably that the pathologist's decision of whether there's cancer spread or evidence of spread really critically determines our course of therapy and our course of treatment. Now let's say that at the time of surgery it looks like the lymph node is free of cancer cells. So in that scenario, that's obviously the best scenario. If it turns out that there's no cancer spread or evidence of cancer spread, then we can move to the next phase of reconstruction, the second surgery, in approximately 3 months, or any time after that. But I like to have a 3-month period to go by so that patients can fully recover and everything is nicely healed and the patient's feeling well enough to undertake a second surgery. And I say any time after that because there's no definitive date later than 3 months where a patient has to be finished with a reconstruction. She can get back to her normal life for a period of time and then have the second surgery when it's convenient to her, because we're not worried about breast cancer needing to be removed or treated. So again, that depends on whether the lymph node tissue is clear of any breast cancer cells. And that decision is only made after the first surgery. That's why we can't make this decision before that first surgery occurs. Now there's a caveat there, because sometimes a breast surgeon will specifically remove the lymph node first as a first procedure in order to determine, is there cancer spread to the lymph node? And then from there, with that information, we can decide what the next appropriate steps for treatment are. If there is evidence of spread to the lymph node, perhaps she might be best treated with chemotherapy. Perhaps we should go to surgery, perform the entire lymph node removal. We would know whether she might need radiation treatment at that point. And so we would get a better sense of the timeline of the whole reconstructive process. So it really depends on the information that we get from the pathologist that determines the overall timeline. That's why I can't say definitively that it's X number of months from start to finish for everybody. It's just not possible to say that. Now let's give the other scenario where there is evidence of cancer spread to the lymph node and a patient needs radiation treatment. Radiation, as I've said previously in the other segments, it's sort of a necessary evil. It is so important to use radiation to treat breast cancer, but the downsides are that radiation induces a scarring process called capsular contracture. It induces the tissues to react with scar tissue and inflammation. Inflammation is just a normal body response or process in response to trauma or injury, and radiation causes tissue injury. So the inflammation can make the tissues much more delicate to handle and much more difficult to facilitate reconstruction. So if a patient needs radiation, then typically my timeline shifts further back as follows. If the patient first undergoes the mastectomy and we get the lymph node tissue, and if there's cancer spread to the lymph node, thus committing her to need radiation treatment, then she will complete the course of radiation treatment, which typically is about 6 weeks. So a healing period first after surgery, and then once she's well healed, then 6 weeks follow of radiation treatment. Then I will wait 6 months after that. After the completion of radiation, we'll wait a period of about 6 months before I perform the second stage of surgery. Oftentimes that second stage of surgery will involve tissue reconstruction, a deep flap or an S-gap love handle flap. But the reason I would really strongly consider tissue reconstruction is because of the scar tissue that can form after radiation, thus making implant reconstruction very challenging. So tissue reconstruction becomes much more important to consider. Okay, so reviewing that timeline. The time of surgery, the mastectomy, then about a month healing period, then 6 weeks of radiation treatment. That puts the patient at about 2.5 months after surgery, and then a 6-month waiting period. That's a fairly long time, but it allows her to kind of get back into her normal daily routine. And that puts us at about 8 or 8.5 months. And then the second surgery occurs at that point. Following that, there may be a third surgery just to kind of complete the whole picture to make sure that there's excellent symmetry. I might have to do a nipple reconstruction in order to finish creating beautiful symmetry and contour. And so there's a 3-month period from the second surgery to the third surgery at least. So we're talking on the order of about 10 to 12 months, or about a year in this scenario, from the first surgery to the very end of reconstruction in the setting of needing radiation treatment. Okay, so the process is much longer. this scenario also is considering tissue reconstruction. So implants, there typically would just be 2 surgeries. Sometimes there's a third, but with tissue reconstruction, there's usually a third surgery. So over the course of the entire reconstructive process, it's about a year.